Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. And I always like to get into my disclaimer and reminder before getting started with our questions that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a patient presents to the office today with complaints of scrotal pain. He states that the pain started a couple of days ago and has not resolved. Upon examination, scrotal edema is noted and Friend's sign is positive. Based on these findings, how should the nurse practitioner diagnose? Is it A, testicular torsion, B, prostatitis, C, epididymitis, or D, BPH? Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first to ensure that you're answering what is even being asked of you. So here, the stem of the question states, based on these findings, how should the nurse practitioner diagnose? And I tell you, if they're asking for a diagnosis, you need to run it back and see what the assessment findings are. So this patient came into the office. He's complaining of scrotal pain, state that the pain started a couple of days ago, and he hasn't had any relief. On exam, the nurse practitioner notes scrotal edema and that the Prin sign is positive. All right. So when you start to think of these things and thinking of scrotal pain, differential diagnoses come into mind. And I really did these questions because one of my QBank students was asking about differentiating between the two and always getting them confused. So I like to kind of show y'all things that present similarly and how to differentiate. So we know testicular torsion and epididymitis are the common things that present with the scrotal pain. But conducting Prin sign lets you know how to differentiate as one of the options, right? So with epididymitis, the Prin sign is positive here, so the best answer is C, epididymitis, okay? Prin sign is positive. All right, question number two. The nurse practitioner has confirmed a diagnosis of epididymitis. The nurse practitioner has ruled out any STIs. How should the nurse practitioner treat? Is it A, Rocephin, B, ciprofloxacin, C, Flagyl, or D, penicillin G? Take a moment and tell me what you got in the comments, you guys. So here the stem of the question states, the nurse practitioner has ruled out any STIs. How should the nurse practitioner treat? So you know what I tell you, if they're asking for a treatment option, you need to run it back and see what the diagnosis is. See if they have provided you with the diagnosis. And if they have not, take it a step further and look at those assessment findings to determine the diagnosis. But here they have provided it, and the diagnosis is epididymitis. So there's various ways you can treat epididymitis. Now, it says here that the nurse practitioner has ruled out STIs. So if the STIs are ruled out, our first line is a fluoroquinolone. So you want to go with B, ciprofloxacin. Now, in the event that they would have tested positive for an STI like gonorrhea, because oftentimes gonorrhea is one of the, I shouldn't say just gonorrhea, but STIs are one of the more common sources of epididymitis. Epididymitis typically stems from an infection that causes the epididymis to be inflamed. Itis in the word epididymitis, right? And so then you're going to treat the source of the cause to the inflammation, right? Or whatever that bacterial source is. So if it's an STI, we treat with Rocephin. If it's our standard bacterial infection, then we're going to treat with the fluoroquinolone. We're going to pull out the big guns to treat that. So ciprofloxacin. So in this case, B is your best answer. And then lastly, question number three, the nurse practitioner and NP student are discussing epididymitis and testicular torsion. The NP student inquires on how to determine one versus the other. What is an appropriate answer by the nurse practitioner? Is it A, testicular torsion is painless, B, epididymitis is painless, C, friend sign is negative with testicular torsion and positive with epididymitis. D, friend sign is negative with epididymitis and positive with testicular torsion. Take a moment and tell me what you got. All right, so here the stem of the question states, what is an appropriate answer by the nurse practitioner? So what are we responding to? The NP student and nurse practitioner are discussing epididymitis and testicular torsion and how to determine one versus the other. I kind of mentioned this in the first question where I was breaking things down for you guys, but one of the most common ways to differentiate is that friend sign. With epididymitis, the friend sign is positive. And I say think of that because epididymitis has a P in it, testicular torsion does not. P for positive, P for friends, right? So with testicular torsion, the friend sign is negative. So what is friend sign? When you're doing the friend sign, patient comes in, scrotal pain, you elevate the scrotum, right? And if the pain relieves, that is a positive friend. If there's no relief with elevation, then that's negative. So let's think a little step further. Epididymitis is inflammation of the epididymis, right? Secondary to some type of infection. So the inflammation and that pressure is from being inflamed is causing the pain. So when you elevate the scrotum, they have relief. Whereas with testicular torsion, the spermatic cord is twisted, cutting off the blood supply. That's where the pain is coming from. So elevation, moving around is not changing that. The only thing that you need to do with testicular torsion is to refer them out for emergency surgery so that they don't have necrosis because the blood supply being cut off, okay? So just remember, friend sign is positive with epididymitis. It's negative with testicular torsion, okay? So C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. If you need any other resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1@gmail.com. Things that I offer are my review book. You can get it in an ebook option or the paperback. Those are both linked in the bio of this channel. If you prefer a self-paced review that you can study at your own pace, each system is designed for family and adult gero. For both exams, there is a non-clinical section to prepare you for both exams. This is also linked in the bio of this channel. The 5-week intensive review, which is a group review. Next one is in September. You will see the link to that in the description if you're looking to enroll for that. For the September course, again, it is 5 weeks. So consider that time frame with your board prep and when you're looking to prepare to test. And then lastly, the one-on-one sessions. There are 3. I always say reach out to us because the one-on-ones are all customized. So we need to gauge what you truly need. But the options are you can book a session for weaknesses, you can book an exam readiness assessment, or you can choose the option for the custom plan where it is designed. You receive a pretest initially. Structured study plan is designed based off of the time that you want to allot to studying. And then I work alongside with you to ensure that you are getting to a successful exam attempt. Okay. So if you need any of those resources, feel free to reach out. But as always, make sure to meet me back here. Happy studying. Bye, y'all.